Everyone's in? Great. Okay. All right. Well, we welcome and thank you for joining us for the second webinar in our series on climate change, health, and social justice. You, your neighbor, and your patient. I forgot to introduce myself. I'm Jennifer Lawson. Today, we'll consider the communal perspectives and intersections of this topic, including opportunities for creating equitable solutions. We're grateful for the support of this series from Sustainable Duke, the Trent Center for Bioethics, Humanities, and History of Medicine, and the Provost Office through an Intellectual Community Planning Grant. So as we begin, we want to acknowledge that we are hosting this series on the traditional territory and land of the Saponi peoples. This is a photo of the annual fundraising run of the Saponi tribe that supports the Saponi Youth Camp and Heritage Program. And this mural is on the multi-purpose building of the Halawa Saponi tribe that houses the community's programs, which are all based on the theme of healing. And the Okanichi band of the Saponi have an initiative to buy back some of its ancestral lands and develop a complex that will include educational purpose. So we would like to extend a warm welcome and thanks to all our speakers for joining us here today. Please let me introduce them. Dr. Aparna Bole is an associate professor of pediatrics at Case Western Reserve University School of Medicine in Cleveland, Ohio. She's particularly interested in the intersection between environmental stewardship, environmental justice, and pediatric public health. She currently serves as chair of the American Academy of Pediatrics Council on Environmental Health and Climate Change. She has served in numerous environmental health leadership roles, including as co-chair of the Healthcare Without Harm Board of Directors, a member of the state of Ohio's Lead Advisory Council, the Lead Safe Cleveland Coalition Steering Committee, the Trust for Public Lands Ohio Advisory Council, and the Ohio Environmental Council's Board of Directors, and a founding advisory council member of the Ohio Clinicians for Climate Action. Tobin Freid is the sustainability manager for Durham County, where she assists county employees, businesses, and residents in implementing environmentally sustainable practices. Most of her work involves reducing greenhouse gases and building community resilience in the face of climate change. She was the lead author of the climate change chapter in Durham County's most recent community health assessment. Tobin holds master's degrees in environmental policy from Tufts University and Duke University, and a bachelor's degree in environmental policy and urban planning from UC Santa Cruz. Isabelle Byers is a fourth-year medical student at Duke University School of Medicine, where she is the co-founder and co-leader of Duke Med for Environmental Justice and Health Equity. Before enrolling in medical school, she completed her bachelor's of Arts in Public Policy with a minor in Global Health at Princeton University. She previously worked at the San Francisco Free Clinic, where she served as a patient advocate and spearheaded the clinic's first smoking cessation program. She has also spent time at the National Academy of Medicine working on health policy issues, including public health preparedness and permanent supportive housing. This summer, Isabelle will begin her internal medicine training at Duke University. She plans to pursue a career in community internal medicine, where she can integrate population health research and environmental stewardship into her clinical practice. Ultimately, she hopes to explore the interaction between health and the environment in order to shed light on the cumulative stressors that underlie health outcomes and place-based health disparities. Welcome. We'll begin today's presentation with Dr. Bole. Thanks.
Thank you, Jennifer, for the kind introduction and for the opportunity to be here with you today. I'm just going to pull up my slides really quickly. There we go. It's especially a pleasure to be here during Earth Month. Happy almost Earth Day, and appreciate the discussion that is truly interdisciplinary. And I love sharing conversation with medical students and trainees. So this is really a pleasure. Thanks for bringing us together, Diane. I am going to speak a little bit about the role of healthcare and health systems in climate action and how that can intersect with our work on health equity and community partnerships. And I should tell you that I'm speaking to you today from snowy Cleveland, Ohio, and these are the ancestral lands of the Erie peoples, who were the Iroquois tribe who originally inhabited Northeast Ohio and still are leading on environmental justice and a major presence here in our community. I have no disclosures today. I know that people are coming to us from diverse audiences, so I'll just take one quick moment to remind ourselves about why climate change is fundamentally a public health issue. And for me as a pediatrician, it's fundamentally a child health issue. And I think it's really important to remind ourselves and those that we are working with and educating that these are effects that are affecting our patients, our communities right here and now, not in some other place or time or another species like a polar bear, our patients here, here and now. So just some examples from my local community. Climate change, because of increasing surface temperatures, can cause increasing formation of surface ozone or smog, which can cause and exacerbate chronic lung conditions, can cause poor birth outcomes. We are seeing more frequent and intense extreme heat waves, with heat being the leading weather-related cause of morbidity and mortality in the United States. So here in pediatrics, I see that with my babies who can't thermoregulate effectively. My student athletes are affected by these extreme heat waves we are already seeing with greater frequency here in our northern latitudes. Also in our northern latitudes, longer and more intense aeroallergen seasons that can affect my patients with allergies and asthma. Combination of the longer season and also higher atmospheric CO2 resulting in some allergenic plants, increased pollen production. We're seeing more frequent extreme precipitation events because of the warmer atmosphere holding more moisture, so that when it does rain, these events are greater. Oftentimes people think of storms like hurricanes, and that those are certainly a risk for our coastal communities. But here in the Great Lakes region, we see it too. And that picture on the left, lower left, is from Northwest Ohio. Extreme precipitation, big storm events can cause a lot of runoff that can both combine with untreated sewage and dump right into the Great Lakes, but also in our agricultural communities mixed with agricultural runoff. And that combined with these warmer, the warmer lake temperatures we're seeing are perfect conditions for toxic algae, which is what you see there. And there are other health effects too that I won't get into in detail: changing patterns of infectious disease, threats to food security and the nutrient density of important food crops, extreme weather events, wildfires, mental health consequences. So really, just a reminder that climate change is fundamentally about public health here and now and in the future. And I know you're all here because of the intersectional interest in environmental health and environmental justice and health equity. Just a reminder, it's a busy slide, I know, but this is, I think, a useful graphic from the most recent climate health and health assessment that the US Global Change Research Program published a few years ago. Just a reminder that not only are children uniquely vulnerable to the health effects of climate change, populations that are historically marginalized, discriminated against, low-income communities are disproportionately impacted by the health impacts of climate change, and these impacts can exacerbate existing health inequities. And this graphic just illustrates why that's true for a variety of reasons. Those are populations that may be disproportionately likely to be exposed to climate risks, may be more likely to have underlying health conditions or other vulnerabilities that render them more susceptible to health harms from these risks, and then maybe fewer resources or social, political, economic capital to adapt or recover from these health threats. So I like to talk about climate solutions as being fundamentally health solutions that also advance health equity. When we accelerate our transition to clean and renewable energy, we immediately benefit from cleaner air. And for children, that means healthier developing brains, better birth outcomes, a lower burden of chronic health conditions like asthma. More sustainable, inclusive, and vibrant cities with safe places for children to walk and bike and play have immediate health benefits: cleaner air, increased social capital, equitable access to amenities and employment. More sustainable food systems and plant-forward diets have immediate health benefits as well as planetary benefits. That being said, I want to just quickly pivot to talk about what is the role of healthcare and health systems and climate action. There's really a growing movement around healthcare engaging in climate action. The report on the left is called Climate Smart Healthcare, and it was published by the World Bank in collaboration with Healthcare Without Harm, describing what climate smart healthcare is. And it's important to note here that the US health sector accounts for about 8.5% of United States' greenhouse gas emissions. The global health care sector is an enormous producer of greenhouse gases. If the global healthcare sector, or even if just the US health sector itself was a country, it would be among the top greenhouse gas emitters in the world compared with other countries. The the report on the right is sort of announcing a call to action that the National Academy of Medicine convened called Decarbonizing the US Health Sector. So really owning this idea that reducing our contribution to climate change is integral to our mission in healthcare. Let me just advance, let's see. Okay, just to point out, this graphic points out that looking at the contribution of various countries to the global healthcare climate footprint, you can just see that the United States really represents an outsized contribution to global greenhouse gas emissions from the health sector. I should say that I'm going to talk really quickly about some specific interventions related to climate action and reducing our environmental footprint in healthcare. And then I will sort of talk about how that ties into our goals around health equity and community partnership and addressing social determinants of health. I would like to say, just sort of at the outset, though, I'm going to talk about things like energy and waste and purchasing, but it should be said clearly that the greenest kind of healthcare is the healthcare that you don't need. And so there is this fundamental alignment around like investing in prevention and public health, preventing the need for resource-intensive healthcare, moving away from the sick care model that we have in the United States. That is inherently sustainable, and it's the most sustainable thing we can do. No amount of solar panels on a medical industrial complex will solve that. So I just want to say that clearly. But just to run through a few kind of categories of climate action and healthcare, lots of opportunities in energy efficiency that can both save operating costs and be beneficial for the planet and for public health. Hospitals represent an outsized contribution of energy consumption in the healthcare sector, but these are interventions that can work in outpatient settings as well. And in the United States, the average commercial building wastes about 30% of the energy that it consumes. So huge opportunities. I think oftentimes we think about resource-intensive healthcare services as the reason for this enormous energy consumption. And yeah, there's some of that, but there are plenty of low-hanging opportunities to reduce waste in energy use in healthcare buildings. I won't go through it in detail, but there's sort of some examples on each slide because I want to get to sort of the community partnerships part. Health systems can also really move the needle in accelerating the transition, our transition to a clean energy economy, because we have enormous purchasing power, and collectively, if we are committing to investment in renewable energy, that can make a big difference with impacts far beyond our own institutions. We're seeing a movement towards that, and I'll talk about in just a second this idea of collective action around climate action and renewable energy. We have an enormous transportation footprint. There are things that we can do to incentivize alternatives to single car commuting for our employees. And we know those have health benefits for our employees, actually, that public transit riders tend to move more, and that we know that there are incentives that will encourage people to walk, bike, carpool, or take public transit. We also have enormous vehicle fleets, and we should be thinking about efficient vehicles, efficient routes, and limiting idling. Supply chain and pharmaceuticals, huge topics, but the majority of our climate footprint in healthcare comes from our supply chain. So there are many opportunities for sustainable purchasing goals, managing pharmaceutical purchasing and pharmaceutical waste that can be incredibly impactful. And a special category of sustainable purchasing that I think deserves its own mention relates to healthier food. We can think about more plant-forward menus in healthcare, think about local purchasing in healthcare, and those interventions have immediate health as well as planetary benefits. I'll just highlight, we used to talk a lot about the food pyramid, and what I like about this image, even though we don't really use the pyramid so much anymore, is that the good foods at the bottom of the pyramid, these whole foods, grains, fruits, vegetables, are also the least environmentally intensive to produce. So lots of synergies here. And finally, waste reduction. Hospitals generate about 29 pounds of waste per patient day in the hospital. So both through purchasing efforts to decrease waste out of the gate and efforts to better manage our waste and divert from landfill and from regulated waste streams can be really helpful for the environment. There is a growing movement of health systems collectively acting on climate. This group is called the Healthcare Climate Council, and is a great example here in the United States. It was convened by Healthcare Without Harm, includes many leading health systems across the country that represented in all of the dark blue states. Our Healthcare Climate Council members are in all of the dark blue states pictured here. Hundreds of hospitals, millions of patient visits, billions of dollars in purchasing power. And so when these health systems are collectively making a commitment to climate action, it impacts their own institutions, but there's also this potential for collective impact in the marketplace and moving the supply chain towards climate action. I want to pivot now to sort of explain why all of that is related to our commitment to health equity and partnership with community to advance community health and health equity. In my city, just like in many cities, our hospitals and other cultural institutions are located right in the heart of some of the neighborhoods in Cleveland that have been historically marginalized, redlined, disinvested, and therefore are seeing generational impacts of health inequities. So it's really striking if we look at any health measure of health outcomes and disparities in our city: life expectancy, birth outcomes, pedestrian injuries, lead exposure. These neighborhoods called Greater University Circle that were historically redlined, historically Black neighborhoods on the east side of Cleveland, for all of those examples of health outcomes, some of the most the poorest health outcomes are in these neighborhoods relative to neighborhoods that are geographically proximate in our own region. And yet, our ivory towers of medicine are located right in the heart of these neighborhoods that are experiencing these poor health outcomes. This is true in cities all across America. And so here in Cleveland and in other cities, our challenge, we sort of took up this mantle of challenge around how can we leverage as major economic institutions in our city that are also anchored in our city. We're not going anywhere. So so-called anchor institutions, typically large nonprofits that employ significant numbers of people and spend a lot of money. We have big economic power. What can we do to leverage that economic power to advance our health mission in a way that is in partnership with community and is inclusive? So in Cleveland, we did that with something called the Greater University Circle Initiative, where our health institutions and our city came together, convened by the Cleveland Foundation, to figure out how we could do that. And we came up with a few domains for action, and we called them Live Local, Buy Local, and Hire Local. Live Local was about incentivizing employees to live proximate to our main campuses and University Circle. We also did some work together on securing federal funds for transit projects. Buy Local was about setting goals around local purchasing of goods and services. And Hire Local was about setting goals around local hiring and inviting residents of Greater University Circle into our workforce pipeline. One tangible outcome of that, and so it created, there was a lot of reporting of these goals and metrics against one another kind of thing in reporting of the Greater University Circle Initiative's work. And it really helped to drive progress, a little friendly competition between our local health systems, our universities. So this was something that was sort of transparent to the public. And one of the tangible outcomes, just as an example, the Evergreen Cooperatives is a local worker-owned cooperative that was created in Greater University Circle out of this initiative, where these companies are designed to provide environmentally responsible and sustainable services that are needed by the anchor institutions. The anchor institutions commit to purchase. They employ residents of Greater University Circle, many of whom have various risks for employment, like prolonged unemployment, for example. The workers have equity stake in the companies. We work with a local workforce development nonprofit to help with job coaching and sort of career coaching, workforce development. And there's a collection of companies now. This is one of them called the Evergreen Laundry, and a proportion of our hospital's laundry is processed by this facility. This kind of came together for me in a recent project that I was involved with at our hospital. We built a new Center for Women and Children, which is the home for my practice, our pediatric resident practice, and outpatient women's health clinic that used to be at our hospital and now is right in Greater University Circle. This is sort of in the heart of Greater University Circle. It's just a little further west than our main campus. And it's in a part of Cleveland called Huff. It's a neighborhood called Huff that was historically there was race riots in Huff in the 60s, a lot of blight and disinvestment in Huff, a ton of environmental injustice inflicted on the population of Huff. This new building was constructed there, and we really wanted to incorporate some of the principles of the Greater University Circle Initiative, principles of environmental stewardship and community partnership in this project. So we convened a community advisory board of neighborhood residents, community organizations, and some of them are pictured below here, to help guide, our programs and services and the physical design of the building. We really focused on sustainable design and construction principles, and we were awarded by the U.S. Green Building Council the highest designation of its leadership in energy and environmental design program, LEED Platinum. We have exceptional energy efficiency and indoor air quality solar panels that generate about 50% of the building's energy use. And we required of our contractor that we needed to work with evergreen cooperatives in installing the solar panels. So it's kind of this like confluence of our commitments to equity, local investment, community inclusion, and environmental justice and climate action. This is a great example of that we have a worker-owned cooperative from Greater University Circle installing the solar panels that are running our building. This just gives you a sense of where we are. Our main campus is to the right of this screen, and many other cultural institutions. And then the heart of downtown is west to the left, and Midtown is right in the middle. And I wanted to share this because we really wanted to not just build a building, but kind of leverage our investment to catalyze additional inclusive and sustainable development in the neighborhood. We worked with our local community development corporation, Midtown, to do that. And I'm really proud that our community advisory board actually continues to meet to this day to be a platform for community engagement and to make sure that we're infusing health and equity metrics into the design of the development program for Midtown, which is called the Midtown Innovation District and spans this entire neighborhood. We were kind of an early investor in this neighborhood. I'll give you another concrete example of an outcome of what that looks like to catalyze additional investment from ours. We worked with a local supermarket chain called Dave's, who opened a new location for their market, much needed in this neighborhood, right next to our clinic. And our community advisory board was convened to work with Dave's around the design of the market to make sure it was accessible to the community. This included constructing a teaching kitchen that our dietitians use for our patients and our community organizations use as well for their clients. You can see our clinic is actually right through the window there, so it's literally across the street. This is just an example of some of the marketing for those programs at the teaching kitchen. Just like there's a growing movement around climate action with the Healthcare Climate Council, there's also a healthcare anchor network, a growing number of hospitals and health systems leaning into their role as these anchor institutions to figure out how to leverage their economic activities to truly invest upstream in addressing what we call social determinants of health, not just screening for them downstream, and to think about the integration between environmental equity, economic equity, and health equity. And I will stop there and turn it over to my fellow panelists. So thank you, and I'm looking forward to the discussion.
Okay, I guess I'm up next. Hello, everyone. Let me pull up my presentation here. All right, so you can all see that. Again, my name is Tobin Freid. I'm the Sustainability Manager for Durham County. And I'm going to talk to you a little bit about what's going on here locally. And some of it will build upon what we just heard. So here in Durham, we heard about certainly lots of climate change impacts and the health impacts of those climate change. Here in Durham, in the Triangle area, we did an assessment several years ago, including Orange County, Chapel Hill, Raleigh, Cary, City and County of Durham, to look at what are the specific climate change issues here in Durham, and found that the top ones were flooding, nuisance flooding generally. And we certainly, if you've been around here recently, the last few years, you've probably noticed more and more that we'll have these large downpours and more streets are flooding. And certainly the health impacts of that, in addition to disrupting transportation, which could be emergency transportation or people trying to get to healthcare appointments or jobs, those sorts of things, emergency vehicles, but also standing water with the pests, mold,
certainly disruption, just even of economic productivity, where people then who are already on the verge of poverty facing even more challenges. So a lot happening with that. And then extreme heat, which is what I'm going to focus mostly on today. That is an issue already we're seeing in Durham, and we'll continue to see into the future. Certainly health impacts with heat exhaustion, heat stroke, but also it exacerbates existing health conditions like hypertension, people who are older or who are younger, people who have disabilities, people who are experiencing poverty, people who are experiencing homelessness, people who are reliant on public transportation because they have to walk on the street, stand at the street waiting for the bus. If the streets aren't shady, it can be very hot. People who work outside, all of those different groups who experience this extreme heat in different ways. And wildfires, and we certainly have the threat of wildfires right here in Durham. We have a lot of forests, we have a lot of urban forest boundaries where people live right up to a forest. But even if those fires are not near us, we see the impacts of that in our air quality. So there were some fires in the mountains not too long ago, and that affected our air quality here in Durham. In fact, last summer when we were working on our urban heat island project that I'm going to talk about, there were forest fires going on in California all the way across the country. And that affected us and our scientific work here. So that is something that has a lot of impact no matter where those forest fires are. And then finally, drought. And that has public health impacts related to dust and the little bit of stagnant water. If you don't have flowing water going through streams, that water can get stagnant, which of course can breed mosquitoes and other vectors for disease, as well as diminishing water quality. And that can impact both public health as well as, of course, aquatic health. So in 2020, Durham County, well, it was actually released in 2021, but we wrote it in 2020, Durham County's community health assessment. I don't know if anyone on the webinar was involved in that. This is something we do every 3 years, and it is a huge community effort. There are well over 100 people from, my goodness, at least probably 75 organizations that participate in this assessment every 3 years. For the first time ever, we had a section on climate change and public health, and we are certainly the first in North Carolina and one of the first counties in the country to include climate change in their community health assessments. But I do think that that's going to change as more and more people do connect climate change and public health as we are here today. And there are 3 sections in this community health assessment, one on extreme heat, one on extreme precipitation, and one on air quality. And I'll put the link to the community health assessment in the chat when I'm done speaking, in case anyone wants to go look through it. We're in chapter 11. It's a very long document, so you have to dig down to chapter 11 to find climate change. And what we found, this is actually goes right along with what Aparna was saying, was we looked at who was most affected by the different determinants of how vulnerable you are to climate change. We looked at poverty rates, impervious surfaces, canopy cover, so tree coverage, percentage of rental versus home ownership, percent who don't have a car that are reliant on public transportation, and the percent without health insurance. And we overlaid that with the redlined, 8 redlined neighborhoods in Durham that have historically had historic racism and the disinvestment, as was previously mentioned, and comparing that to Durham County as an average. And what we saw here, these are the green bars are average for those 8 neighborhoods, but I will say for every single measure, for every single of the 8 red lines, they were higher than the average. So even though this is an average, there were none that were lower than Durham County's average. Except of course for say canopy cover, where you see the Durham County average is higher than the red line, and that is a negative thing because it's showing that more tree coverage in the rest of Durham than in these redlined neighborhoods. And so that goes to prove then that people living in these areas are more vulnerable to all of these climate change risks. So as I mentioned, I'm going to talk mostly about extreme heat today, and you can just see quickly here that this is an estimate of change in number of days with a heat index of 90 degrees or more. And we see it all over the country, but we see it more here in the Southeast. And you can certainly see in North Carolina, we are expected to see some of the worst of that. And then down in the bottom graph, you can see 2 projections. The blue line is the lower emissions projection. So that's assuming that we, by we meaning the entire world, meet our pledges under current treaties on climate change. And the green line is assuming we sort of have business as usual and keep going off the way we are. Either one, even under the best case scenario, we're still definitely seeing a large increase in number of days over 95 degrees in Durham County and really in the not so distant future. So this heat is not distributed evenly across our community. There is a concept called urban heat island, and basically areas that have a lot of concrete, a lot of bricks, a lot of dark surfaces, do not have a lot of trees, do not have a lot of green open spaces. Those places with a high concentration of impervious surface and concrete absorb that energy from the sun and increase the heat in those particular areas. And so we wanted to understand better what that profile looked like in Durham and be able to then see which areas we need to concentrate our efforts in. So we partnered with the Museum of Life and Science, the National Weather Service in Raleigh, Activate Good, which is a local organization that activates volunteers, the City of Raleigh, and NOAA, the National Oceanic and Atmospheric Administration, helped fund a project to actually map out heat islands in Durham and in Raleigh. On the same day in July, I mentioned that this was affected by the wildfires out west because the temperatures early in the week were expected to be in the 90s, and because of that smoke that was coming over, it actually lowered our temperatures down into the 80s. So that was an interesting combination of climate impacts that day. But what we did was we mounted these sensors onto volunteers' cars. We had over 100 volunteers that day. We also had handheld sensors where people could walk in areas where people weren't driving. So in parking lots, on pathways, at schools, things like that. And we had people go out in the morning, people go out in the afternoon, and people go out in the evening for 1-hour blocks and measure the same route with these sensors. The sensors measured temperature, relative humidity every 15 seconds. And then all that data were put together. Oh, and then this is an example. We also had infrared sensors. And so this is just a view from the, I think it's the center deck in Durham. No, Chapel Hill deck, looking down into Durham. And you can see the difference in temperatures just in this image. So when we had all that data, it got crunched and munched and turned into some maps that show the area that was mapped at these 3 different times of day. And you can see in the morning, there are some hot spots, those red areas, which are pretty urban. And I think the one to the far left might actually be Duke Medical Center, which is a lot of concrete and buildings there. And what that shows is that even overnight, those areas don't really cool down. And so the heat that's trapped continues radiating. One of the issues with extreme heat is not just how hot it is, but it's also how long you're exposed to it. So is the duration. And also exposure overnight. So if the temperature never really goes down, then bodies don't really have an opportunity to cool down and recuperate. And so even staying warm overnight, even if it's not that hot as it is during the day, still has implications for our health. Then during the afternoon, you can see that it's a little more uniform across the town. And then in the evening, you can see again some of these spots that are showing that they really aren't cooling down as much as the more forested areas, less impervious surface up in the northeast of town. Then this data, we crunched and munched it again. So those maps are available, but we also wanted something more accessible. So the Durham Community or Neighborhood Compass, which is available online, is a great resource if you haven't been there. And it has all sorts of maps on, and you can overlay a lot of different things, demographic and environmental, health, housing, all those kinds of things. So it's a great resource. We just got this up this week that shows census block groups based on their heat at different times of day. So you're welcome to go look at that, and I'll put that link in the chat as well when I'm done. So we just did this. We just got our maps back. Before we created the maps, we talked with different neighborhoods about what was important to them, where the routes should be, where are people hanging out during the day, and they were part of the people who helped us collect the data. So now we want to go back and share the data and look at a lot of these questions. What areas are impacted? Who lives there? What resources are impacted? Which communities and populations are most exposed and vulnerable? What's the distribution of green space? Are there trees, parks? How equitably are they dispersed? What structural types and designs are featured and associated with the higher and lower temperatures? And can we build more of the beneficial structures and less of the ones that are more heat related? And can we still have higher density that we know we need and mitigate the urban heat? So how do we do all of these things? So these are conversations we're going to be having with the community and trying to figure out what our next steps are. Some of the things that we're already doing, we do have cooling centers. So like heating centers in the winter, we do have cooling centers available. So on very hot days, people can, if they don't have access to air conditioning, can go to these cooling centers. Planting a lot of trees in partnership with the city and Keep Durham Beautiful and Trees Durham and other community groups, and with a focus on planting a majority of those trees in neighborhoods that have historically not had that investment in them. Of course, splash parks are available. The city provides those. And then this picture on the left are two images of the new Durham County Library right downtown. If you haven't been, please go. It's beautiful. And what we really tried to do is instill features in this that would help mitigate urban heat island in that downtown area. So you'll see green roofs, you'll see that white surfaces, a lot of vegetated area around it. It's a building we're very proud of. And finally, I just want to talk about yet another, this will continue. So we're not going to do an all-out campaign like we did last summer, but we do have these handheld devices that are available. And different community groups are welcome to use them and get more information about their specific local areas. There is a partnership building with Durham Public Schools to integrate this into their curriculum. So teaching students how to use this and going to places around their schools and the neighborhoods around their schools and studying that temperature. So using it as a teaching aid, but also being able to gather a lot of information to make these areas where children are spending a lot of time healthier for them as we continue to see rising temperatures. My children go to year-round school, so I'm particularly interested in this because it's very hot in July and August and even September when they're in school. And that is all I have. I will turn it over to the next speaker.
Thank you so much, Tobin and Aparna. I will share my screen. All right, and a special thanks to Jennifer Lawson and Diane for putting this together. My name is Isabelle Byers, and I'm a fourth-year medical student here at Duke. I will be talking a bit about a project that I worked on alongside a classmate of mine, Alexander Gunn, over the last year. We were fortunate to receive funding from the Duke University School of Medicine Chancellor's Service Fellowship to partner with a community organization in order to address community health outcomes. So the project that we pursued is called Planting Change for Environmental Justice and Health Equity in Durham. Our project, the goal was to increase tree canopy coverage in historically redlined areas of Durham in order to combat structural racism and promote positive health. We aim to do this by following 3 aims. The first one was to leverage population health data to determine the area of Durham that would most benefit from planted trees. 2, we wanted to engage community leaders and neighborhood residents to steer project vision. And 3, we wanted to cultivate novel partnerships across Duke and Durham to create a sustainable project. Just briefly as an aside, I wanted to mention the relationship between cardiovascular disease and a specific component of our climate, which is tree canopy coverage. Trees, there's a growing body of evidence that tree canopy coverage impacts health by removing fine particle matter in the air, reducing extreme urban heat, and increasing parasympathetic activation. There are several sources on the bottom of this slide and a quickly growing field referring to this, but I wanted to briefly reference to give you an idea of the kind of health outcome that we are tying into our community health project here in Durham. This slide has 2 maps. One on the left is a map from 1937 highlighting the Trinity Park neighborhood. For anybody who's a Durham local, you may recognize kind of Duke's East Campus and surrounding neighborhoods. And then another map on the right of the Highway 147 kind of diagonally coming across, and just south of that is the Hayti neighborhood here in Durham. The difference between these 2 maps, hopefully you can see the red numbers in the map on the left indicate places where trees were originally planted by the city in 1937. And on the right side, you see a lack of tree canopy coverage early on. Unfortunately, this disparity still exists today. These are updated images. On the left is a LiDAR resolution image of tree canopy coverage in Durham with the darker shades of green showing an increased coverage, and the lighter shades where trees do not exist. On the right side is a Google Maps image showing with green dots specific tree planting sites that the city has invested in over time. And this map itself is from 2018. You can see the red box outlining a specific area in Durham around Hayti where trees still lack, and there's decreased coverage. We then overlaid using Durham Neighborhood Compass a kind of health outcomes map, specifically looking at cardiovascular disease in the Durham area. And you can see an increased burden in the community that I recently highlighted in the maps previously. And this falls disproportionately on residents in the Hayti community. So going back to our goals, beyond kind of examining the data and potentially where a planting site, where the best planting site to invest in would be, we wanted to engage community leaders and neighborhood residents to really steer this project vision. Ultimately, we did not want to repeat anything that had been done before, and we did not want to place any burden on residents in the area to take ownership of this project and carry it on in the future. So we wanted to be diligent about who we were engaging, what the current needs were in the community, and how best to support and facilitate that project. So we set out to assemble a resident-led stakeholder board to steer project vision and execution. And to do so required education on our part and recognition of history in the area in order to understand current goals of the community. It also included outreach to community advocates, business leaders, and local residents. And we also sought the expertise of our home institutions resources, specifically Duke's Community Engaged Research Initiative. Importantly, history plays a big role in any intervention, current day intervention or project that gets at health equity and health outcomes. Specifically in the 1960s, as part of a federal urban renewal project, a Highway 147 was constructed in Durham's downtown area, and that ultimately displaced a large portion of the Hayti neighborhood. Specifically, 500 businesses and around 4,000 families were displaced. And you can see a present day image of that highway in the top right, and below that is an old image of the specific area that was demolished, and the subsequent kind of change to the infrastructure of the surrounding area after the Durham Freeway was constructed. So this matters because it informs how the initiative, the tree planting initiative, can be shaped and informed by this history and align with the current needs of that community. We had amazing leadership from community residents and business leaders in that area. Specifically, I want to mention Anita Neville, who is the daughter of a Hayti business owner, and she is a large advocate for her community, and specifically educated us, as well as Angela Lee from the Hayti Heritage Center, on the current goals for the Hayti community to receive revitalization money in order to connect Hayti to the greater downtown Durham area, from which it was separated due to North Carolina 147 being built. So their current goals include not only revitalization for housing and economic development, but also building safe walkable paths and greening the space around the Fayetteville corridor, which today is a very, very busy intersection, and about 18,000 cars pass through that on a day-to-day basis. So we, after reaching out to several members in the community, we formed a stakeholder board, ultimately of 10 individuals from a variety of sectors, including business, culture, many from the religious sector, education, and also public service. Over the course of 2 months this past fall, we held stakeholder board meetings over Zoom, and we provided an honorarium for our members' time. Importantly, this couldn't have been done without help from the Hayti Heritage Center. As I mentioned, Angela Lee, who's the executive director there, was able to help us get a foothold and recruit other members in the community who would provide great insight for the project. Ultimately, we decided on specific tree planting sites. Again, this is a map on the left from 1937, again, where kind of tree canopy coverage does not exist. We aim to plant along East Lawson Street. You can see those images on the right with the pink dot showing specific sites we wanted to plant in. Importantly, our stakeholder board was a huge part of shaping these planting sites and provided incredible feedback, particularly around safe places to plant. East Lawson Street here is very hilly, and oftentimes when residents pull out of their driveways, trees can obstruct their view. And so we were very diligent about where specifically we wanted to plant so as not to impede or disrupt any kind of safety in that area. Our third aim beyond leveraging data and engaging community members was to cultivate novel partnerships to create a sustainable project. Again, we did not want this to be a short-term or short-lived tree planting project, but we really wanted this to take root in the community where years to come it would be funded, and tree maintenance would be not a residential burden. So a partner of ours, the City of Durham and Keep Durham Beautiful, have pledged to continue to plant in areas of Hayti, and also will be maintaining the trees that have been planted from our project in the fall. Additional members or additional stakeholders include Trees Durham, the Rotary Club, and sustainability initiatives at Duke. Ultimately, we received over $10,000 in funding for our planting project. $3,000 came from our fellowship program. The Duke Carbon Offset Initiative provided a matching grant of $5,000. The Durham Rotaract Club and Duke Med Engage also provided substantial funding. On the day of planting, we had about 60 volunteers donate their time, 23 from the North Carolina Central University, 20 students from Duke University, and 16 community-based volunteers. We planted 91 trees at $100 per tree from different species of trees to promote biodiversity. And you can see some of these pictures from the day of planting here. We were featured in our School of Medicine Magnify magazine, which further highlights some of the partnerships that we made if you're interested in learning more. But I think the most important thing for us was not necessarily that we planted a couple or around 100 trees, but that we really shaped the goal of future tree plantings. Prior to planting change, the City of Durham planted trees according to neighborhoods being targeted in essentially not through an equity framework. But what our project did was encourage the City of Durham and its partners, such as Keep Durham Beautiful and Trees Durham, to go about plantings through a lens of health equity and really understand the populations that have been disenfranchised over time, and how we can promote restorative justice throughout that process. So the City of Durham for next year, they have pledged 200 to 300 more trees for the Hayti neighborhood, and Keep Durham Beautiful has planted an additional 60 trees on April 2nd on Arbor Day this year. Ultimately, what we learned is multifold, but three important takeaways. One, that community engagement really is the most important step, and that this takes time. I think if we could do it again, we would start earlier, and we would have many more meetings and seek as much insight as we can about the community needs. And then ultimately, it's very important to pay for or reimburse for the time of the individuals who are graciously donating their input. Two, climate change is a public health and equity crisis. And that gets at our overall theme for today's webinar. And then three, sustainability and health equity goals are compatible and ought to be aligned. The Duke Carbon Offset Initiative specifically has pledged to continue funding tree plantings for several years to come. And that is in direct alignment with Duke's overall sustainability goal of becoming carbon neutral by 2025. So hopefully in the future, we can learn from this project and use it as an example for how we can align several goals that are isolated and essentially work together to achieve a common goal. I wanted to quickly acknowledge the people involved in this project. This does not include everyone, but importantly, the community members who really shaped and steered the vision of this project. I want to give a special shout out. Their advice was invaluable, and I look forward to working with them and learning from them in the future. I will go ahead and open up for questions. I realize we may only have a little bit of time left.
Oh, wonderful. Dwight, you've already have a question. So thank you all so much for your really thoughtful work and presentations. Dwight, please go ahead.
Yeah, this is wonderful initiative. Correct me if I'm wrong. I think that most of these plantings are street side, and that's a limited area. You know, one of the proposals to combat climate change is to have people plant 1/2 of their yards in native plants across the USA, and that could have a really great impact. Is there any initiative to help people to plant trees on their own yards?
That's a great question. You're absolutely right that a lot of these are street sites. To my knowledge, there is not any kind of push by the city to do that. I think the reason why the city of Durham's Division of Urban Forestry was able to support this project is because trees would be planted on public sites. Although I know that Keep Durham Beautiful and Trees Durham are working with community residents to be able to plant on private land. But at the moment, the city of Durham, I believe, is not engaged in anything like that.
That's great to hear, though, that KDB is working on this.
Maybe I can just pose a question to you all. You've all mentioned really robust partnerships. Do you have any particular advice to share with respect to how you develop them? Because they're they don't just come out of the blue, right? So any for you all, any comments for any of our panelists?
One thing I might say, because I have had some experience in navigating those partnerships on behalf of our health system. And I think there are some complexities in representing a large organization. You know, relationships are about humans to humans, of course. And I think like the biggest piece of advice is like really showing up authentically over time and have those relationships not be transactional. And that takes a lot of time. But, and I think everyone has had those experiences who have worked in partnership with community. But I will just say, like the institutional side, just a practical thing, there were some challenges for us in our institution around like leadership worrying about like risk and liability and like what does it mean to have a community advisory board? What kind of board? Is it a governance board? That doesn't seem right. And like a lot of just kind of legalities and logistical concerns about managing expectations and getting the words right. So one thing that we did is we modeled our language for our community advisory board around our patient and family advisory councils, which many hospitals have some flavor of that, right? So they have some familiarity with the language of what it means to set up a patient and family advisory council and what is the role of that group. So what I did to satisfy our powers that be, that was a big hurdle for us, was to like model the language exactly. I just copied it basically and just tweaked a little bit of it. And I said that to them. I'm using the exact same language. The expectation will be the same. And we also negotiated with some of the investment in our new clinic to be able to offer honoraria to, payment for community residents who are representing themselves in the community advisory board, and any organization that wanted to could accept the honorarium on behalf of their organization. So those are, I think, were two critical, just practical pieces to get this off the ground.
Hey, this is John Moses. I'm a pediatrician here at Duke, and this was such a fantastic program, and it's given me a lot of food for thought. And in terms of affiliations, I'm just thinking about affiliations that may already have been established, but are you all working with, for example, the Nicholas School of the Environment, which I guess is now where there used to be a forestry program at Duke, but I think it's been folded into the Nicholas School. So I'm thinking of that possible affiliation if it doesn't already exist. And then how about urban planning students over at NC State and other places? I mean, there's so many folks that I know would be interested in what you all are saying.
That's a great comment. And actually, you alluded to something that's connections that have recently been made thanks to the small planting project we did in the fall. Afterwards, we were specifically at the School of Medicine, we were contacted by students from the Nicholas School and also the urban forestry and urban planning, interested in getting involved, connecting our graduate student groups. We ultimately formed a student group out of this, but the hope is for this to be very interdisciplinary, like you're saying, and ultimately projects like this that intersect many things from health equity to healthy city planning to climate change and environmental justice require many stakeholders at the board at the table. And so we're hopeful that those connections going into next year can make for more robust and more sustainable projects as well. And that's been a really exciting thing to be a part of.
Well, we are at time, but thank you all again to our wonderful speakers for sharing their work, and for our audience for being here, and also for Diane Sanchez for helping us do all this organizing. So thank you and have a great afternoon.
Thanks, everyone.